Hi, my name is Lauren Wilson, and today I'll be presenting my gait development project. So let's go ahead and get started. So gait development starts in early childhood. It begins in the infantile reflexes and spontaneous movements. Examples being thrusting of the arms and legs. The thrusting of the legs while laying on the back is also known as supine kicking. And then we have stretching and clenching of the fingers and toes. So motor milestones are one being a landmark or turning point in an individual's motor development. The motor milestones are influenced by maturation of central nervous system, development of muscular strength, endurance, posture, and balance, and improvement of sensory processing. Some atypical deviations would be exhibiting a reflex when the individual should not be, and not exhibiting a reflex when the individual should be. So early childhood gaits, let's go ahead and watch this video first. So as seen in the video, the child has short strides, arms are at a high guard and move sporadically, legs wider than shoulder length apart. Initial contact is flat-footed and remains flat-footed in loading response. Mid-stance has very little control and balance, minimal flexion and non-weight bearing leg. An early childhood gait abnormality would be clubfoot. Clubfoot is when the foot appears to be twisted or upside down. It does not cause the individual any pain or discomfort. Treatment includes stretching and casting, or stretching and taping, sometimes even surgery. Every 4 out of every 100 babies are born with a foot deformity. A lot of them don't even have to go into treatment or see a specialist for the abnormality to go away. Some do. Some don't even, take the matters into going into surgery. Some just allow it to do its own thing, stretch, any exercises that improve the normality of the foot. Rate limiters. So infants must have muscle strength in the trunk and extensor muscles in order to maintain an upright posture. They must develop balance or an erect posture so they can compensate for the shift of weight from one leg to the other. So moving on to gait development in childhood. By 4 years of age, most children will have mastered the essentials for walking. Children will exhibit pelvic rotation, knee flexion, foot contact at the shoulder width apart, synchronizing of the arm swing, and heel-toe striking. The strides will also increase in length, and velocity of walking will increase as well. Children will also adopt double knee locking, which assists the full range of leg motion. The knee extends at heel strike, flexes slightly as the body weight moves forward over the supporting leg, and then extends once more at foot push-off because the knee extends twice in one step cycle, giving its name double knee locking. And possible gait abnormalities in childhood would be toe walking, which is walking solely on the ball and toes of the foot. Possible causes could be disorder movement, muscle tone or posture caused by injury or abnormal development in the parts of the brain that control muscle function. Let's go ahead and watch this video first.
Good to go. Very good. Going back to your mom. Uh-oh. Good job. Okay. Good job. Can you throw it? Oh, no. Oh, wow.
As you watch her walking is normal. She does walk on her tippy toes a little bit, but she exhibits, for the most part, all the central steps in advancement.
All right, that's good. Good job. Okay.
So perceptual and physical constraints. Children not getting enough playtime. Playtime allows children to use those muscles and they get familiar with one another. They strengthen themselves, and we learn by doing. Technology distractions such as video games, cell phones, and computers. When we're distracted and watching those things, we're not exercising our muscles. They're not getting familiar with one another, and they're not developing. Um, Physical constraint could be many known abnormalities such as clubfoot, crouch, cerebral palsy, and Down syndrome. Gait in adulthood. There's little to no change from childhood to adulthood, considering essentials are massive in childhood. If there are any variations, it may be due to individual constraints, such as weight gain or loss, increase or decrease of strength and balance, or an injury affecting gait. Let's go ahead and watch this guy's gait movements.
During stance and swing, there are multiple subcategories of gait called phases. Each phase is distinguished by a combination of joint motions and positions, which we refer to as critical events. So for the phases of gait, we have initial contact, loading response, mid-stance, terminal stance, pre-swing, initial swing, mid-swing, and terminal swing.
Okay, so as we watch that, we notice the base of support are in the heels of the feet. Stride length is about the same length as the trunk, which is normal. Arm swing is parallel to the legs, but swing in opposition of the legs. So as the left leg is going forward into stepping, the right arm is swinging forward. Initial contact, the weight is on the heel of the weight-bearing leg, and the leg in swing is leading with the heel. Mid-stance, the weight is bearing solely on foot planted on the ground, and the other leg is in loading. Flexed and preparing to land heel first. Terminal stance, the weight is now on the opposite leg of mid-stance and in the ball of the foot, and the opposing leg is straight forward with heel landing first. Pre-swing, one foot planted and knee slightly bent, opposing leg in loading, preparing for swing, weight in the toes of the foot, and leg slightly flexed. So now we're moving forward to gait in older adulthood. After adulthood, the changes seen in older adulthood are similar to the beginning stages seen in early childhood. So as in early childhood, we see the stride length is short, pelvic rotation is short, ankle extension decreases, and velocity of walking will also decrease. Let's go ahead and watch this baby.
Nós vamos fazer teste para poder ver como que a senhora anda, tá? Sem a mão aqui, a senhora consegue levantar?
So as you can see, when she walks, there's very little hip rotation. Her feet, they stay flat planted. There is no heel to toe.
Vamos
Her
virar.
legs are not swinging. There's very little stretching going on. The arms do swing a little bit. They are in opposition with the legs.
Pode sentar aqui de novo. Senta aqui.
So an abnormality in older adulthood gait would be osteoporosis, also known as osteoarthritis. It's the condition where the bone becomes brittle from loss of tissue. Factors causing that would be aging, genetics, change in hormones, deficiency of calcium and vitamin D. And they are most commonly found in the hips and knees. As we know, these are the main joints that are used in walking. The hip is very important, and the knees. We need those for the flexing. the stepping, the striking, which all takes place in the hip muscles and bones and joints. Rate controllers. So balance is affected by age as muscle support decreases. Due to the increase of imbalance, fear of falling limits the individual to the amount of walking desired and change the gait posture. So widening the stance and outtoning would be difference in posture that you would see. So physical and perceptual controllers, fear of falling, immobility in joints essential for walking, which is hips and knees, and then disease that affects muscle and bones. So as we talked about, osteoporosis is one that does affect the bones. And that concludes my presentation today. Thank you guys for watching and joining me. And God bless. Have a good day.